Okay, let's unpack this then. Today on the deep dive, we're looking at something pretty fascinating. It's about the future of medicine, really. How ready are future doctors to actually use all this new digital health tech and AI? We're diving into a specific study here: digital health competences and AI beliefs as conditions for the practice of evidence-based medicine, focusing on students in Canada.
Yeah, exactly. This deep dive is really about figuring out what, actually prepares these future physicians.
Mhm.
Because healthcare is becoming so tech-driven, we need to know what skills they need for evidence-based medicine, or EBM.
Right,
And
EBM.
EBM is just so crucial, isn't it, for better care, better outcomes, even managing costs effectively.
It really is a foundation, isn't it? Good modern healthcare relies on it. Better resource use, better
Yeah.
care, patients are happier. It's about making sure decisions are solid, based on evidence.
Exactly. No guesswork, just what works best. And that's where this digital shift becomes so important. Digital health, dHealth, and AI, they aren't just sort of fancy add-ons anymore.
No, they're becoming fundamental.
Absolutely integral. They promise, better quality, more personalized care. The World Health Organization even has a whole global strategy for dHealth now.
That really says something, doesn't it? A global strategy. So, okay, how did this particular study tackle this? How did they look at the students?
Well, it's quite neat, actually. They did a cross-sectional survey, looked at 177 medical students at the University of Montreal, and they measured their dHealth skills, how they felt about AI, and then how that all connects to practicing EBM. They were really trying to fill a gap, understanding specifically how these tech skills affect EBM practice.
Okay, so they surveyed these students. What did they actually find? Were the students ready?
Well, this is where it gets really interesting. On the one hand, yes, the students generally know about dHealth tech. They have that foundational knowledge. And they tend to see AI playing a big role down the line, in their own work. They're optimistic.
That makes sense. You'd expect them to be aware of the tech buzz, right?
Why?
But I sense a but coming.
There's a but, a big one. While they have the knowledge, their experiential competence, like their actual hands-on skills using these dHealth tools.
Ah.
Yeah, that was pretty limited. There's a clear gap there.
Okay, so they know about it but haven't really done much with it.
Precisely. And here's the kicker. The study found a really strong link, a positive connection, between those experiential, hands-on dHealth skills and actually practicing EBM effectively.
Wow. So the more they'd actually used the tech.
The better they were at applying evidence-based medicine. The connection was significant, beta value of 0.42 for those interested in the stats.
That's quite strong. So it's not just about being tech savvy in theory, it's the practical application. What about the AI part? How did that fit in?
Good question. That hands-on dHealth experience,
Yeah.
it also positively influenced how students viewed AI's role in the future. And that positive view of AI, in turn, also had a positive effect on practicing EBM, though a bit smaller.
Okay, so experience with current tech makes you more positive about future tech like AI, and both link to better EBM.
Exactly. But the really crucial point, maybe the most important finding for educators, is this. Just knowing about dHealth, that book knowledge,
Yeah.
it showed no significant link to practicing EBM. None.
So lectures and textbooks on dHealth aren't enough?
It seems not. It's the doing. The practical, hands-on experience seems to be what really translates into better EBM practice.
Right. That really makes you think about medical training, doesn't it? If knowing isn't cutting it, what does that mean for how we teach future doctors?
It definitely points towards a need for change.
Yeah.
We have to boost students' hands-on, experiential dHealth skills. The fact that these skills were low in the study, well, that's actually good news in a way,
How so?
because it means there's a clear target for improvement. We know where to focus training. Medical schools probably need to rethink curricula.
Move beyond just lectures.
Absolutely. More practical sessions, maybe things like medical hackathons or capstone projects where students actually use dHealth tools to tackle clinical problems. Simulations, maybe.
Getting their hands dirty with the tech, basically.
That's the idea. And interestingly, while AI is obviously huge, this study suggests maybe we should prioritize broad foundational dHealth skills first. Build that practical base before focusing too heavily just on AI.
Get the fundamentals right.
Exactly. And there's this really interesting idea emerging too, a kind of symbiotic relationship between AI and EBM.
Symbiotic. How?
Well, AI could actually help doctors do EBM better. Think about wading through mountains of research. AI could help generate and synthesize evidence much faster. It could break down some old barriers.
So AI could actually empower doctors to practice EBM more easily.
That's the potential, yeah.
So bringing this all together, What's the key message for you listening in? Whether you're just curious or involved in healthcare, it really feels like the focus needs to shift, right?
It does. It shifts from just knowing about technology to being able to actively use it to master it in practice.
Yeah. This research really drives home that preparing our future doctors isn't just about filling their heads with facts from textbooks.
No, it's got to be about hands-on engagement, using the very tools that are already shaping medicine and will continue to do so.
It leaves us with a pretty big question to ponder, doesn't it? If medical education really embraces this doing over just knowing,
Yeah.
how much faster could we see real advancements in patient care? How might that truly reshape healthcare delivery in the coming years?